Women do have a higher incidence of certain eye diseases. They're more at risk of developing eye disease due to underlying conditions such as diabetes and hypertension, because their risk is higher. And also of glaucoma. They're more at risk of going blind. I think women tend to see an eye doctor less. There are also certain conditions, so for instance, underlying health conditions such as autoimmune disease. Women are more prone to developing autoimmune disease, and so they're more prone to developing those kinds of eye conditions as well, which range from dry eyes to inflammation in the eyes. Times when hormones are raging are highest, those are the times when the eyes become affected. So for instance, after childbirth, women's eyes can be affected. Perimenopause and menopause, when the hormones change, so when progesterone and estrogen wane, those hormones are responsible for oil production with regard to the tear film. And so we find that women tend to develop dry eyes as they go through perimenopause and menopause, and a lot of them complain of the eyes being stinging or burning, or they have to blink a few times. Perimenopause can be happening as much as 10 years before menopause starts, and so what happens is that the cornea actually becomes less elastic as we go into that period, and what happens is that you may even develop a refractive error, refractive change, so a change in glasses or even presbyopia during that period. There is a type of glaucoma called rubeotic glaucoma that can develop after you've had a blocked vein in the eye, or after you have what we call proliferative diabetic retinopathy, which is when blood vessels grow in the back of the eye because the oxygen supply isn't so healthy. And so what happens is those blood vessels grow at the front of the eye and the pressure goes up, and women are more at risk of getting that type of glaucoma. And the eye becomes a blind, painful eye. And that's because of their risk of diabetes. We know that 1 in 3 persons with diabetes can get diabetic retinopathy or changes in the retina because of diabetes. Autoimmune diseases such as rheumatoid arthritis and Sjogren's syndrome and lupus, those conditions are more prevalent in women, and those can cause inflammation in the eye, inflammation at the front of the eye. It can also cause changes at the back of the eye. It's important as a woman to get your eyes checked regularly. You can see your optometrist or your ophthalmologist at least once a year. I would say when you turn 40, you should have an eye check, because this is when conditions such as glaucoma, they are the ones that become apparent when we are in our 40s. One of the things that I can't stress enough is the importance of safety with regard to when you're cooking, making sure that you're not exposed too much to heat. If you have to do any kind of laundry and anything splashes into the eye, for instance, make sure that you wash your eye out carefully. I've actually had a grandmother who lost her eyebrows when she was baking. So it's really important as women to make sure that we may be in different aspects. We may be professional, we may be in the home, maybe be out in the garden, but to always make sure that we take care of our eyes.